Hey everyone, and welcome. Today we're jumping into something really fascinating, a surgical innovation that's not just about a better technical fix, but about completely rethinking what success even means for a patient's quality of life.
All right, so here's how we're going to break this down. First, we'll tackle a really tricky surgical problem. Then we'll look at a pretty brilliant new solution and the amazing results it's getting. After that, we'll zoom out a bit, see how this fits into a bigger, smarter strategy, and wrap up by thinking about what this all means for the future of this kind of surgery.
Okay, so first up, let's really get a handle on the problem here. We're diving into something called Fossa Navicularis strictures, and trust me, fixing them is way more complicated than it sounds. And that really brings us to the key question surgeons are wrestling with. How do you fix a problem in one of the most delicate parts of the human body without, accidentally creating a bunch of new ones? Because a real success here isn't just about getting things working again. It's got to be about preserving appearance, sensation, and making sure the patient is genuinely happy with the outcome.
So, to get down to brass tacks, what is a fossa navicularis, or FN stricture? Well, it's basically a narrowing right at the very tip of the urethra. The easiest way to picture it is like a kink in a garden hose. It blocks the flow, and as you can imagine, that causes some pretty major issues.
But here's the thing, fixing that kink is super tricky. Just restoring the flow, that's really only the beginning. The old ways of doing it often meant splitting the glands, which, you can see the huge risks there for bad cosmetic results or even changes in sensitivity. And to make matters worse, if there's an underlying inflammatory issue like lichen sclerosus, these repairs can just fail. So it was crystal clear that a much better approach was desperately needed. Okay, so if the old way has all these problems, how do you come up with a better one? Well, that's exactly what our first source gets into, this really innovative technique that was designed to solve the very challenges we just talked about. So, the solution has this long, technical name, a transurethral dorsal inlay buccal mucosa graft. Whoa, right? But let's just break that down. Transurethral just means the whole thing is done through the urethra. No big external cuts, no splitting the glands. And buccal mucosa graft, or BMG, that's actually pretty cool. It just means they use a tiny living patch of tissue from the inside of the patient's own cheek. And the procedure itself it's really elegant. So step 1, the surgeon makes a super precise incision on the top side of the urethral wall, right where the blockage is. Step 2, they take out a tiny triangular piece of the scarred tissue that's causing the whole problem in the first place. And finally, step 3, they stitch that little graft from the cheek right into place. It's basically like putting in a brand new, healthy, flexible pad. Now this is what I love about this slide. It shows you the genius of this approach so clearly. If you look at A, you can see the incision is made completely on the inside. Then B shows the little space they create after taking out the scar tissue. And in C, you see the graft being put right in. It's all done internally, which means the outside, the appearance of the glands, is totally preserved. It's brilliant. Okay, a clever technique is one thing, but does it actually work? I mean, that's the real question, right? So let's dig into the data from the study and see what actually happened when they put this into practice. And the results? Well, you can pretty much sum them up with this one incredibly powerful number, 100%.
So what does that 100% actually stand for? It represents a perfect functional success rate. Think about that. In the entire study, every single one of the 16 patients had 0 obstructive symptoms and needed 0 extra procedures for, on average, almost 2.5 years. I mean, that is just a phenomenal outcome. And you know what's even better? That perfect technical success translated directly into how the patients felt about it. When they were asked, a full 100% of them were either satisfied or very satisfied. And that's a huge deal. It shows the surgery didn't just fix a mechanical problem, it delivered a result people were actually happy with.
And the good news just kept coming. It wasn't just about flow and satisfaction. The surgery nailed other critical quality of life goals too. Anatomic success was almost 94%. And this is huge. Over 91% of patients said their sensitivity was either the same or actually better than before. There were no new cases of erectile dysfunction, and get this, every single patient said they would recommend the procedure to someone else. So yeah, this one technique is a massive leap forward. But it also points to an even bigger idea, which comes from our second source, that real lasting progress in medicine often comes when we zoom out. When we go from perfecting a single procedure to creating a smarter overall strategy for treatment. You see, for a long time, how these strictures got repaired really just came down to something called surgeon preference. Basically, it depended on what a particular surgeon was used to doing or felt comfortable with.
But the new way of thinking is totally different. It's about using an algorithmic approach, a systematic, evidence-based roadmap that helps the surgeon pick the absolute best option for each unique patient.
And this flowchart here is a great picture of what that actually looks like. Now, don't worry about reading every single box, just follow the logic. A surgeon starts at the top when a patient comes in. Then, depending on key things like what caused the stricture in the first place or the patient's specific anatomy, they follow a specific path down the chart. Each path leads to a different recommended procedure. This whole system makes sure the treatment isn't just based on habit, it's methodically tailored to get the best possible result.
So, does this more systematic way of doing things actually work? Well, the data says a resounding yes. A study that followed this exact kind of algorithm found a 92% success rate and a 94% patient satisfaction rate. I mean, those numbers are right up there with the amazing results we saw from that specific gland-sparing technique. It proves that a smart system can lead to consistently great outcomes. And the authors of the paper said it perfectly. They wrote that an algorithmic approach allows for decision-making to move from that of individual surgeon preference to a more systematic methodology. It's all about making care more consistent, more rooted in evidence, and in the end, just plain better for the patient.
All right, so let's tie all of this together. What does this new technique and this new way of thinking really mean for the future of reconstructive surgery?
This table really lays out the whole evolution in thinking perfectly. The traditional approach, often more invasive, based on what the surgeon preferred, and really just focused on one goal, restoring flow. The modern approach we've been talking about, it's less invasive, it's systematic, and it defines success in a much bigger, more meaningful way. It's about restoring flow and preserving appearance, function, and most importantly, total patient satisfaction.
And that really gets us to the core takeaway here. The huge shift we're seeing isn't just about one new, better way to operate. It's much bigger than that. It's about embracing a whole new philosophy of surgery, one that is systematic, minimally invasive, and puts the patient's complete well-being right at the heart of every single decision. And that leaves us with one last big question to chew on. This trend, this way of thinking goes way beyond this one type of surgery. So what does it mean for the future of all of medicine when a patient's own satisfaction is seen as just as important as the technical success of a procedure? It's a really profound change, and it's fundamentally reshaping how we think about what it truly means to heal.